I think the time is up now. Let's begin. Good day or good evening, everyone. This is Vicky from Wisonic Medical. Welcome to join this global webinar of Wisonic Dental College. Here is a platform for sharing and learning more about ultrasound applications to anesthesia, pain management, and intensive care. Today, it is really an honor to invite Dr. Fadil and Dr. Mohammed here. Now welcome Mr. Yep from Spectral Scientific, the partner of Wisonic Medical in Malaysia. He will give a brief introduction to Dr. Mohammed at first.
Good evening and good day to everyone, especially to our speakers, Dr. Sharidan and also Dr. Mahfizul Mamat, and also Miki from Wisonic and all the doctors all around the world. I'm Yap, I'm the Business Development Manager for Spectra Scientific in Berhad, Malaysia, and we are the distributor for Wisonic in Malaysia. I'm honored today to introduce to you our moderator of tonight, which is Dr. Mahfizul Mamat. So Dr. Mahfizul Mamat currently is the head and consultant anesthesiologist in Gleneagles Medini Hospital. He provides anesthesia for all the specialties and heads the critical care section of the hospital. Being responsible of the critical care management in the hospital, he is also involved with several hospital management committees in ensuring quality service being delivered. Dr. Mamat got the Masters of Anesthesiologist in University of Malaya, postgraduate diploma in clinical ultrasound in University of Melbourne, fellowship in regional anesthesia in Royal Perth Hospital, and also studied perioperative medicine in University of Monash. And he got his Masters of Business Administration also in the International Medical University. The special interest of Dr. Mamat is cardiothoracic anesthesia, transthoracic anesthesia, transesophageal echocardiography, ultrasound-guided and nerve-stimulated regional anesthesia, advanced life support and trauma, and high-fidelity simulation. So without further ado, I welcome our moderator for tonight, Dr. Mahfizul Mamat.
Thank you very much for the introduction. That was kind of you. Good day. Assalamualaikum. Salam sejahtera, as how we say it in Malaysia. To those who have tuned in from wherever you are in the world, welcome. A big thank you to Wisonic Medical for inviting us to be here tonight. For us, we are in the evening at 9 p.m. And of course, thank you and welcome to everybody. Okay, one cannot, and I will be your moderator today, one cannot deny the fact that recently how ultrasound scientific basic knowledge and technology have played a more important role in providing optimal care in anesthesia and critical care. Hence, the two topics that will be touched by our eminent speaker today, Dr. Sharidan Fadil. In Malaysia, clinical ultrasound was picked up by the non-radiologists, such as the anesthetists and intensivists, firstly for insertion of invasive lines and peripheral nerve blocks back in 2007 to 2008. And as anesthetists, the usage of ultrasound has become revolutionary in defining the most astute care for our patients. As the usage of clinical ultrasound gained a wider audience for acute care, the take-up from the emergency department as well as the intensive care unit medical personnel became more prominent in helping to confirm the clinical suspicion of differential diagnosis for a more definitive care. Perioperative ultrasound practice is important, not just for our own perioperative management assessment, sometimes as partners to the surgeons as well, in terms of assisting them when they would need intraoperative ultrasound to be done. Hence, it is with great pleasure for me to introduce our speaker today, Dr. Sharidan Fadil, who was one of the pioneers in the practice of clinical ultrasound in Malaysia since 2007. I'm very lucky to have him as part of my team in my department in Gleneagles Medini, Johor. The two topics that he will present today would be the overview of perioperative ultrasound and lung ultrasound for anesthesiologists. Dr. Sharidan is a very prominent speaker and well known amongst the anesthesia and intensive care fraternity in Malaysia, as well as in the Southeast Asian region, as well as Asia. He was a medical graduate from the University of Malaya, Malaysia, and obtained his FRCA. He was then attached to a teaching hospital, National University of Malaysia, before playing his trade in Singapore and came back to Malaysia in 2017. Dr. Sharidan Fadil was the past convener of the Special Interest Group in Regional Anesthesia, College of Anesthesiologists, Malaysia, from 2009 to 2017. He is currently the director in the board of directors of the Asia Oceanic Society of Regional Anesthesia, AUSRA. He had also served as the president of the Society of Emergency and Critical Care, Critical Sonography, Malaysia, and currently still sits in the executive committee board. He actively publishes in journals with interest in ultrasound-guided regional anesthesia, point-of-care ultrasound, and airway. Without further ado, I present to you Dr. Sharidan Fadil.
Thank you very much, Dr. Mahfizul Mamat, for the kind introduction. I would like to thank Wisonic for inviting us to share with us our passion in perioperative ultrasound. Assalamualaikum and a very good evening from Malaysia to all the audiences throughout the world. Okay, without further ado, I would probably start my presentation now. I'm just going to press the share screen. Desktop. Okay. Okay, can everybody see the PowerPoint presentation? Okay.
Yes.
Okay, we'll start the ball rolling. I've shared this topic at various platforms, actually. This one was at the ANSCA meeting, Australian-New Zealand College of Anaesthetists meeting sometime last year in Kuala Lumpur. This was a near similar presentation in the Malaysian Society of Anesthesiologists meeting that was held June last year. So the talk will be about the same with some adjustments here and there. In terms of disclosure, as the talk is hosted by Wisonic, Wisonic has agreed to pay me a small amount of honorarium for the trouble. This is where I work at the moment with Dr. Mahfizul. It is a 200-odd bed tertiary hospital with nearly all the specialties and subspecialties available. And this is what I do on a nearly everyday basis. Just to highlight this point, this is actually a breast tumor where the surgeons removed it, and he has asked my help to actually confirm whether he has actually managed to excise the whole tumor. Of course, this is not something that I do on a regular basis, that I'll share more of my assistance with the surgeons in my later slides. Again, as mentioned, I have been the past convener of the Special Interest Group in Regional Anesthesia under the auspices of the College of Anesthesiologists, Academy of Medicine, Malaysia. We, the SIGRA, leads the fraternity in terms of propagation and training of the art and science of regional anesthesia in the country. I also mentioned I was the past president of the Society of Critical and Emergency Sonography, which is actually the WinFocus Malaysian chapter. WinFocus stands for World Interactive Network Focus on Critical Ultrasound, which is actually a non-profit body with the passion and interest to spread the use and science of critical or point of care ultrasound. So in order to start the ball rolling, it's also important that how we look in the past and how ultrasound has actually been practiced by anesthesiologists. If you look at the literature, it was in 1978, there was this actual article on the use of Doppler ultrasound in the detection of the subclavian vein. So basically, the Doppler was used to actually locate the subclavian artery, and the supraclavicular block was performed with a kind of a hybrid landmark technique. It was only in 1989. This was actually the first documentation of ultrasound-assisted peripheral nerve block. So this was two authors from Singapore, actually. What they did was actually in the upper image was actually an auxiliary view prior to a block. So, and then they put down the ultrasound and perform a block as a landmark technique, and then subsequently afterwards took an image, a video of the block, after the auxiliary compartment afterwards. And you could see definitely there's a lot more LA at this particular point. So this was the first documented ultrasound-assisted peripheral nerve block. Subsequently, Stephen Capral and an Austrian group did an ultrasound, real-time ultrasound guided supraclavicular block. And you could see this is actually pre-block, and this was post-block. So even at this point in 1994, there was probably more of imagining rather than imaging, because it's technically, very difficult. Again, I'm just going to show you what was before and what was after. So at this point, now with more advanced machines, what we can actually visualize is a lot more of the microstructures. This was actually a publication by a colleague of Manoj Kamakar. So what he did was looking at, this was the distal sciatic nerve at the popliteal area. And if you, with a high frequency machine and with high resolution, what you can see is not just the nerves, but the structures, the fascia around it. Like for example, you can see the paraneural sheath, the epineurium, the nerve vesicles itself, and the subparaneural compartment. So there's a lot more that you can actually see. And this is actually helpful, particularly in doing a very targeted block. And then more recently, we had, in 2011, there was a description of using ultrasound in assisting in doing spinal and epidural. So this was a publication by Chin Kijin and Kamaka. So just skimming through it, I'm not going to go into great detail because in the interest of time. So what we normally do is actually look with the transverse view, particularly to look at the centrality of the spine, and looking at the paramedian sagittal oblique view to look at the levels. Again, this is what you look for in the transverse view. And this is where, you look at the tip and you mark the centrality of the spine. This is in between the spine, where you can see in a patient who is probably a bit younger, you can actually see even the posterior complex. This is where the ligamentum flavum and the dura sits. And then there's also been description of using particularly using the linear probe to locate the interlaminar space for thoracic epidural, and then approaching it using a paramedian approach. More recently, interfacial plane blocks has been described very well and has become popular. The initial description was for the tap block. Now, this was the tap block, and for those who are probably new to ultrasound-guided facial plane block, these are the three layers of the abdominal wall muscles, the external oblique, internal oblique, and transversus abdominis, and this is where you put the local anesthetic to perform the